Cybersecurity, threats to private practices. Your practice is one hack away from financial disaster. Here's how to protect it. This is Legacy Lens. I'm your host, Andy Eigner. For more than 25 years, I've worked in IT and cybersecurity, helping medical practices strengthen their security posture, protect patient data, and stay ahead of threats that most people don't even see coming. And today, I want to talk about something that's no longer optional for any practice, cybersecurity. Because the reality is simple. Your practice is one hack away from financial disaster. And the bad guys know it. Let's get into it. Vendor breaches. The breach you didn't cause, but still own. Cyber criminals have figured out a smarter way to attack healthcare. Why hack one practice when you can hack the vendor that serves 500 of them? A real case. Change Healthcare 2024. A ransomware attack shut down the largest medical billing clearinghouse in the country. The fallout. Claims couldn't be submitted. Practices lost weeks of revenue. Some took out emergency loans. And even though practices weren't at fault, HIPAA investigations still landed on their doorstep. The data behind the risk. Business associates, aka your vendors, make up only 11% of breach reports, but they account for 2 of the 4 largest breaches in early 2026. TriZetto, 3.43 million patient records exposed. Navia, 2.15 million patients' records exposed. This comes from the Health and Human Services Office of Civil Rights Breach Portal Security Analysis 2026. These numbers represent individual patients, not practices. One vendor breach can drag hundreds of small practices into a regulatory nightmare. The takeaway. You need a healthcare-focused IT partner who can manage vendor risk, provide vetted security tools, run penetration testing, monitor systems 24/7, explain everything in plain English, and document your compliance. A strong IT partner isn't optional, it's foundational. Ransomware, the modern practice shutdown. Examples provided are for illustrative and educational purposes only and are not intended to predict future outcomes. Cybersecurity risks and impacts vary by organization. Orthopedic practice in Colorado. A staff member clicked a fake Microsoft login page. Attackers encrypted every workstation. The fallout. 9 days without charts. Canceled surgeries, $120,000 paid in ransom, $80,000 in remediation costs, permanent data loss, and HIPAA investigation. The data behind the risk. Federal breach data shows 69% of healthcare breaches start at the server level, and those breaches account for 90% of all affected individuals. The source is the Health and Human Services OCR Breach Portal Security Analysis 2026. Server breaches expose entire databases, not just a few files. The takeaway. Your IT partner should implement offline backups, zero trust segmentation, multi-factor authentication everywhere, quarterly phishing tests, a written what-if plan. Social engineering, the new front line. Attackers don't break in anymore. They convince someone to open the door. Dermatology practice, Florida. This breach started with a phone call. A staff member received what looked like a routine support call from the electronic health records vendor. The call ID was spoofed. The terminology was perfect. The attacker even referenced the practice's actual EHR version. He said, "We are seeing errors from your location. I need to re-authenticate your connection before your afternoon patients." He directed her to a fake support portal, identical to the real one. She entered her credentials. The attacker captured her username, her password, her multi-factor authentication bypass token. Within minutes, he logged in as a legitimate user and quietly downloaded the entire patient database. The fallout. Public reporting listed 14,000 patients' records exposed, full demographics, diagnosis, biopsy results, $150,000 HIPAA fine, $40,000 legal fees, 3 months of reputational damage, mandatory corrective action plan, and public posting on the Health and Human Services Wall of Shame. But here's what practices never talk about. The real cost was far higher. Breaches of this size typically cost $250,000 to $600,000 in total remediation, forensics, legal counsel, credit monitoring, IT cleanup, downtime, and policy overhauls. And remember, OCR, the Office for Civil Rights and Health and Human Services, only publishes the civil penalty. They do not disclose the full financial fallout. One practice owner said, "We had policies. We just didn't think they applied to us." This is the modern threat. One person, one moment, one phone call. HIPAA liability, the financial hammer. HIPAA penalties are rising fast. Recent settlements include 1.19 million, 1.5 million, 3 million, and 4.75 million. Serialized ransomware enforcement. OCR has launched a numbered ransomware enforcement program. Ransomware investigation number 1, ransomware investigation number 2, and ransomware investigation number 3. This is unprecedented. It means enforcement is systematic, not random. OCR is building a library of precedent. Expectations are now explicit. Small practices are absolutely included. OCR checks whether you had a current risk analysis, a functioning risk management plan, encryption, multi-factor authentication, vendor oversight, a written incident response plan, ongoing staff training, proof that policies were followed. If any of those are missing, OCR treats ransomware as a compliance failure, not bad luck. Ransomware is no longer just a cybersecurity problem. It's now a regulatory problem. Debunking the "we're too small" myth. This is the most dangerous belief in private practice. The data shows median breach size 2,451 individuals, 772 large breaches in 2025, a record, 46 large breaches in January 2026 alone. This statistic comes from Medicurity's 2026 HIPAA enforcement and breach trends analysis, which pulls directly from the Health and Human Services OCR breach notification portal. Small practices hit hard. Gulf Coast Pain Consultants, 1.19 million in penalty. VPN Solutions, OCR ransomware enforcement. Elgon Information Systems, ransomware settlement. Small practices are not too small. They are the primary target. Continuous training, the only real defense. Technology helps, but training is the firewall. Most practices train once a year. Physicians skip training. Staff forget training. Policies are ignored, and there's no accountability. What works? Monthly micro-trainings, quarterly phishing tests, annual full training, random spot checks, real consequences. If physicians don't follow the rules, staff won't either. What if policies, your emergency playbook. Every practice needs a clear plan for system outages, who to call, how to communicate, how to operate manually, how to document the incident, how to restore safely. Your IT partner should build and test this playbook. This is Legacy Lens. I'm your host, Andy Eigner. Cybersecurity isn't an IT project. It's a clinical risk, a financial risk, and a leadership responsibility. Your practice is one hack away from disaster, but with the right IT partner, the right policies, the right training, and the right culture, you can protect your patients, your reputation, and your livelihood. Thank you for listening and for taking cybersecurity seriously. Your patients are counting on you. Thank you.